Thank you for joining the Black Guardian News Media. It is Tuesday, June 30th, 2020. And today, folks, we're going to be going over the Dr. Anthony Fauci and other key health officials testifying before the Senate coronavirus hearing. Just in case you missed it, folks, do you not remember when your phone updated, the health app updated? This is a rollout. This is they're telling you, they're giving you a peek inside of how they're rolling all of this out, how they continue tracking your whereabouts, what you buy, you sell, who you talk to, who visits you, who you visit, continue peeking into your personal life. Contact tracing. Contact tracing is the process of identifying people who may have come into contact with an individual with an infectious disease. The process involves identifying infected people, determining who they have been in close contact with while infected, and asking people who are potentially infected to stay home until it is clear that they are not sick. How are they supposed to do this? Let's take a look at this video.
Public health infrastructure. I'm told that in Alaska, as we are doing our contact tracing, it is still a paper copy Excel spreadsheet faxed to the epidemiology labs. This is how we're doing our tracing. I thought, well, maybe that's just Alaska, and I'm told by Dr. Zink, who you have all had conversations with, that, well, this is actually going on in California as well. That, to me, is not a contact tracing system that works and is sufficient. So I want to ask about not only your view of the sufficiency of contact tracing, and this is probably to you, Dr. Redfield, but then, Dr. Fauci, I want to ask you about the concern that we have with certain parts of the country where you have public mistrust of vaccines in general. My fear is that we may get to the place where, we will get to that place where we have that successful vaccine, but we still have the concern from many and a mistrust, and whether it's vaccine hesitation or vaccine confidence, I don't know what the buzzword is, but I'm worried that we don't have a plan for how to deal with that. So first contact tracing and then the vaccine.
Thank you very much, Senator. I think it's really important just to highlight what you said about the current state of data systems for public health in the United States, that they really are in need of aggressive modernization. And again, thank Congress for the funding there, but it is a substantial investment that needs to take place. There are a number of counties that are still doing this pen and pencil, as you commented, and we need to have a comprehensive, integrated public health data system that's not only able to do something that's in real time, but actually can be predictive. And it would be one of the great, I think, investments of our time to make that happen once and for all. And that's really fundamental to be able to operationalize contact tracing, et cetera. And contact tracing in this case, and I'll be very quick, really doesn't have any value unless you can do it in real time. It doesn't help like I just did with the airlines, where we had people that were flying infected from Afghanistan and we didn't get the information until day 14, day 15, day 16. It's irrelevant. So again, we love the partnership to get an integrated public health data system, not just for CDC, but for all of our jurisdictions across the nation, into one timely integrated system.
Senator, thank you for the question about.
If you could be succinct, we're well over time.
We'll be quick. We have a community engagement program that is embedded within the sites where the vaccine trials will be done, because we're thoroughly aware of what you're concerned about, and it is a reality, a lack of trust of authority, a lack of trust in government, and a concern about vaccines in general. We need to engage the community by boots on the ground and getting community, particularly those populations that have not always been treated fairly by the government, minority populations, African Americans, Latinx, and Native Americans. And we have a program that's already operable right now to do that. Thank you.
So there you have it, folks. They're trying to roll out where they can have real-time live data tracking you and everyone else around you through your mobile devices, through your smartphones, through your smart devices, even through the Alexa that you have in your very own house. We have to be mindful of this, folks. It's going to be very interesting to see how this all unfolds in the coming years, because this coronavirus is not going anywhere. As you can see, the country is almost at another closure. There's talks of another stimulus check. And it is also interesting how they throw around the disparity of the Black and brown communities, the African American communities, the disparity of low income for healthcare, and reiterating the underlying issues that many Black and brown communities face through the disproportionate healthcare, through the disproportionate of the economy, wealth gap down through the years. I mean, we just celebrated Juneteenth. We all know what happened there. This was at the hands of their own doing. And now, once again, as we look at the history of the Tuskegee experiments, through the Tuskegee syphilis experiments through African American men, this is what they're saying, how they're going to roll out through African American communities of a vaccine. Because they know they cannot be trusted. They just show you how they're going to roll out to lure you into taking their vaccine. A vaccine of you being a test dummy, so that the rich and the powerful be able to have a real and more true vaccine to be combated against this virus. Take a look at this video and I'll come back with the rest of my commentary.
Operations Warp Speed, along with the crucial support from BARDA and other federal agencies, public-private partnerships, and accelerating groundbreaking technologies that could eradicate COVID-19 and revolutionize, frankly, the vaccine development landscape. Because of these efforts by industry, academia, and government working in concert, we could see a viable candidate or candidates in a matter of months for a vaccine. And because of a growing number of large-scale manufacturing agreements with companies like Moderna, Pfizer, and J&J producing hundreds of millions of doses at risk, which means in advance, we are already working to address issues of access, and this is critical, especially for our most distressed communities. That said, effective development and widespread access, while essential, are only part of the equation. If and when, and I feel optimistic that it's when and not if, we get a viable vaccine, we need to encourage folks to choose to get vaccinated. I was really concerned when I saw a recent AP survey that showed that only 49% of American adults plan to get vaccinated once the COVID-19 vaccine came to market. A full 20% said that they did not plan to get vaccinated, and 1/3 of Americans were not sure. Given the public's recent and vital focus on health disparities, it's worth noting that among certain groups, these figures are even more alarming. Just 25% of Black Americans, 37% of Hispanic Americans plan to get vaccinated against the coronavirus. My question to the full panel: what steps can we take at every level of government and in the private sector with healthcare providers to ensure a proactive education campaign and outreach strategy on the importance of getting vaccinated, both for COVID-19 and frankly, even more broadly?
I'll take a shot at it first, Senator. As I mentioned in response to another question, that we have a community engagement program that actually operates out of Operation Warp Speed, the vaccine development program component of that. Also, there needs to be engagement of people who the community trusts, particularly individuals who are noted sports figures or whomever. When we were involved and continue to be involved in community engagement with HIV, we used people in the community, boots on the ground, to go out who looked and lived and are like the people they're trying to engage. It's very critical because I share with you the concern that we get to the hoop and we get through it of getting a safe and effective vaccine, only to find that a substantial proportion of the population do not want to get vaccinated. Of particular concern is it's that proportion of the population that generally are the most vulnerable in the sense of the minority communities, African Americans, Latinx, Native Americans, who in fact, because of underlying conditions, make it more likely that if they do get infected, they would have a poor outcome. So it's extremely important to engage them at the local level. Thank you.
So there you have it, folks. Just be mindful of this rolling out. We know what they're trying to do. We know what's going to come from them trying to lure you in to take this vaccine. We just must be mindful of the data collection through our smartphones, through our smart houses, even down to our smart refrigerator. They know what we eat, when we sleep, when we wake, who we talk to, who we visit, who visits us. We just got to continue to maintain our safety, wear our mask, practice the social distancing, wash our hands, so that when all the test dummies have taken the vaccine and have died out, then at some point we'll encounter some kind of immunity to this coronavirus 2019. But leave me a comment with your thoughts in the discussion below. Don't forget to subscribe and share this video. Leave a thumbs up. Thank you for choosing Black Guardian News Media. I'll catch you in the next round.